Hello, these are the current events by me, Noah Bay.
So, what's happening right now? Well, prisoners are being vaccinated. New York has recently been mandated by Justice Alison Tuitt of the New York State Supreme Court in the Bronx, who ruled to begin the rollout of vaccinations to prisoners across state penitentiaries and prisons. Now, Governor Andrew Cuomo's office hasn't made any intention of appealing the decision and stated that eligibility would be expanded to inmates across the state level, suggesting that vaccinations will begin in the very immediate future. Also within the realms of this topic is in regards to Texas rollouts. Now, Texas prisoners over 65 and with pre-existing health conditions are now also receiving coronavirus vaccinations, despite months after their eligibility was recognized by the Texas Department of Criminal Justice. Many other states are also beginning to roll out vaccinations to prisoners as well.
Now, many of you may be asking why the matter is important currently, and there are several reasonings for the importance of this event. So, incarcerated individuals held within prison compounds are normally subject to overcrowding and tight living conditions, a reduction in access to public health tools, and protective equipment, such as masks, gloves, and etc. By design, correctional facilities are built to have high occupant densities and are subject to, again, overcrowding that could lead to high infection rates of the coronavirus. Individuals that are held within these facilities are oftentimes visited by guards who conduct inspections, welfare checks, and other forms of maintenance, and also by visitors of a more personal nature, such as families. Now, the coronavirus is more than capable of jumping from prisoners to other prisoners, eventual off-duty guards, and to families who could serve as instigators of further outbreaks across the cities of the United States and the states within it. Now, not all individuals are held within detention facilities for extended periods of time, as some are awaiting trial and decisions regarding their crimes, leading them to be in further contact with officers and others in court. Some may even be released and will also be in contact with individuals outside the prison walls, furthering infection rates. And not only that, 40% of these prisoners held in the United States detention facilities are already recorded to have chronic medical conditions that include hypertension, asthma, and diabetes, rendering them vulnerable to COVID-19 outcomes such as death. The social or historical background regarding the COVID-19 patterns and infection rates within prisons throughout the year-long lifespan of COVID-19 within the United States can be displayed through the data below. The below data states that there have been several peaks of cases within incarcerated populations. Now, as of March 23, 2021, at least 951,000 people in the prisons of the United States have tested positive for the illness, an increase of less than 1% from the week before out of the said population. 268,566 prisoners have recovered from the said population. The constituents of the data at a state level also reported their respective numbers, but only several were listed. 49,324 cases were reported in California, 34,344 cases were reported in Texas, 25,929 cases were reported in Michigan, 17,930 cases were reported in Florida, and federal prisons reported 49,324 cases of COVID-19. The data suggests that cases first peaked in late April of last year, when states such as Michigan, Ohio, and Tennessee began mass testing of prisoners. The timing of the initiatives and their trends had suggested that the coronavirus had been circulating among people within these facilities without symptoms in greater numbers than previously known in the prior month as well. The numbers begin to trend downward by January 19th, 2021, fortunately, with COVID-19 safety protocols starting to really take effect within detention facilities. COVID-19 has really done a number on these facilities, and there has been a quite large number of prisoners who have been infected, evident above in the data, and could be the rationale as to why some state governments are pushing for vaccination of prisoners. My predictions vary on a state-by-state basis, but I expect rollout of vaccinations to prisoners to increase steadily as vaccine rollouts in some states, such as California, Connecticut, and Kansas, have included prisoners in their early vaccination phase plans. As such, I expect prisoners to be kept safe from the coronavirus in the immediate coming months of the year in these states. However, some states are yet to make inmates eligible, such as Florida, and will require some time to determine vaccine eligibility of these inmates. It will be a crucial decision regarding inmate eligibility of the vaccine in order to curb a potential fourth wave that seems to linger on our minds and on the minds of authorities, and I really do believe Florida and other states will respond accordingly. Another current event is the Myanmar protests that are still occurring. Just last Saturday, Myanmar has suffered its most deadly day since the staging of the coup against Aung San Suu Kyi. Police and soldiers in Myanmar have reportedly killed dozens of people, including children, as the military celebrated the 76th Annual Armed Forces Day in the capital with a parade. The death toll has reached, reportedly, about 107 to 114 from various reports. The police also shot at people who were attending the funeral for a 20-year-old student who perished on Saturday, who was also a member of the All Burma Federation of Student Union, which has in the past supported pro-democracy movements. Violence continues to escalate, and the Security Council of the UN is likely going to be held as a result of the situation in Myanmar. The Council has called for restoration of democracy to the Myanmar government, or what's left of it, and some historical and social background around the worsening situation in Myanmar. Myanmar saw a coup staged on February 1st, 2021, in which the locally known military known as the Tatmadaw arrested very prominent figures in the Myanmar government, as said above, due to their suspicions regarding fraud in the November election of last year. They entrusted all power to their senior general Min Aung Hlaing. The situation continued to deteriorate as the Myanmar government suspended internet access and ordered armored vehicles to occupy cities across Myanmar. On February 20th, 2021, security forces of the Tatmadaw were ordered to fire at protesters, striking workers, and others. February 28th of 2021 saw a total of 18 people die as a result of police firing at protesters, and another 38 people on March 3rd, 2021. Some of my predictions regarding Myanmar include Myanmar's situation, which seems to be worsening as time goes on. I don't believe it will be alleviated anytime soon. Now, I also believe that extreme censorship within Myanmar doesn't appear to be going away anytime soon, with the Myanmar military still in power with Aung Hlaing as the senior president. And I also believe that trade relations with Myanmar will deteriorate with countries of a high democracy index such as Germany, the United States, and etc.